We don't know what science is going to look like in the next 20 or 30 years. Imagine they find a cure for cancer. But what if that cure for cancer depends on one little thing that you only have once in your life? And I'm talking about cord blood banking. So I brought the experts on board, and Sister Bronwyn Rousseau is from Netcells in South Africa, and she's going to tell us what exactly umbilical cord stem cell banking is, how they do it, and what it is used for.
Lizanne, absolutely. So stem cell banking is that banking of the cord blood and the cord tissue that is left over after the baby's been born. Now, stem cells are basically the building blocks of our bodies. So every cell in our body started as a stem cell. So the cord blood stem cells and the cord tissue stem cells do two different things. The terminology that we use in the medical world is the stem cells from the cord blood are called hematopoietic stem cells, and those are the guys that would stimulate regeneration of a diseased or damaged bone marrow. And the stem cells from the cord tissue, they're called mesenchymal stem cells. They are responsible for generation or manufacture, for lack of a better word, the connective tissue on the body. So we're talking about bone, cartilage, ligament, tendon, nerve, fat even, but nobody really wants to regenerate fat, but it's possible to do so with those kind of mesenchymal stem cells. So the whole idea, the concept behind banking is to have these stem cells as a different source of a stem cell transplant. So in the good old days, before stem cell banking was discovered as a medical opportunity, the only source of stem cells for a transplant was that harvested from the bone marrow. And that, in the good old days, was a horrible, very painful procedure. Now, fortunately, science has developed that kind of procedure, even using adult stem cells, is not so sore anymore. But the adult stem cells are older and more exposed to real life. And the stem cells from a baby's cord are brand new. They haven't been exposed to life, and they are able to replicate and regenerate so much better. And we have now an opportunity to offer families to store these stem cells for future potential medical use. And we know that stem cell banking in South Africa in particular is still in its infancy. Our company is turning 20 years old next year. We're only seeing the actual use of cord blood stem cells in a transplant to regenerate that bone marrow, as I said. So once the little one is delivered, the leftover cord blood is taken out of the cord and put into a little collection bag, and the cord tissue is a piece of that is collected into a little test tube, brought to our laboratory, and we extract and process those cells.
Is that painful for anybody involved?
Not at all. Okay, so it's becomes part of the delivery process. So in between the time when the baby is born and the afterbirth, the placenta is delivered, that is when the collection gets done. So yes, we use a needle to take the blood out of the cord, but the cord's got no nerve endings in it. Okay, so nobody feels any pain. The baby doesn't feel pain because the baby's already separated in mommy and daddy's arms. The cord blood is collected by the gynecologist or the midwife at the delivery. The blood is drained into a bag, almost the same way as you go when you donate blood to South African Blood Transfusion Services. The bag almost looks exactly the same. And the blood is then drained into that bag. You just don't feel that owie like when they put the needle into your arm. The cord doesn't feel that needle going in. Okay, and then it's drained. It adds about maybe 3 to 5 minutes to the whole delivery process, and then it's all collected. When the cord is cut, also the same story. There is no nerve ending there, so it's not painful for anybody.
One of the big questions: I want to do delayed cord clamping. Does it interfere with that, or is it not possible at all?
Okay, I'm going to answer that in two parts. The delayed cord clamping is absolutely possible with stem cell banking, but we have to compromise. Okay, so when we're doing delayed cord clamping, it is passive delayed cord clamping. In other words, the cord is left to pulsate on its own without active milking toward the baby, and for a maximum of 60 seconds. And then baby must be separated so that we take then what's left over in the cord into the bag. So it is possible.
If you want to know a little bit more about delayed cord clamping, and I made this video before I spoke to Sister Bronwyn, and where they say that the minimum time that a baby should be exposed to delayed cord clamping is minimum 60 seconds, so you are well within that range, which means even if you watch the video, I'll put it up right here, but if you are considering something like stem cell banking because you're thinking 20-30 years ahead of now and you don't know what life is going to be like, then you know at least you can still give your baby the benefits of delayed cord clamping money and everything that comes with it. Once it ends up with your company at Netcells, what happens? What do you do with it? Does it get tested when it arrives there? Or at what point do you bank, and what exactly does banking then mean?
Absolutely. All right, so yes, the stem cells are collected in your Netcells box, which does get delivered to your home or to your workplace before your baby arrives. You take that along to the hospital. The contents of the kits are then dealt with the staff delivering the baby. The cord is collected, the blood is collected and packaged in the box, and that box is sent back to us as is. Okay, when we receive the sample at the laboratory, we do a quality control first. Okay, so we check the sample, make sure that there's no leaks, we make sure that it's correctly labeled with the name on the box needs to be the same as the name on the blood bag. We do the same checks on the cord tissue. We check volume, and we check volume by weighing the bag, okay, because we want exact. So 1 milliliter equals 1 gram, okay, and then we work out volume. If we've got a volume more than 50 milliliters, we then don't have to do what we call a pre-test. And when we do a pre-test, we do it on the lower volumes because we don't want to process something that we may not be able to use. And on that note, when we need volume, when we talk in volume, we say ideal collected volume is between 80 to 100 mils. The bag that is provided can hold up to 150 milliliters of blood. So the idea is to get as much blood as possible to get as many cells as possible. So the volumes that are a little bit lower than the 50 milliliters, we run a pre-test, and if they pass the criteria, then they get run through the full process. If that sample doesn't pass criteria of the pre-test, it isn't processed, because we don't want to waste your resources and we don't want to create unrealistic expectation with processing a sample that we know that the stem cells numbers are not going to be sufficient for utilization in the future. So if that does happen and you've paid us or you've moved into a payment plan, we will reimburse accordingly. Okay, so you don't pay for anything that is not processed or used or stored. Okay, so we check the weight, the bag then gets moved into our clean room. We take a little bit of the blood to test the baby's blood group, which will then report to you, and then the extraction of the stem cells starts happening. Okay, so we've got an extraction process that takes all the stem cells out, and that gets separated into another little storage bag. That storage bag is frozen down to minus 190 degrees Celsius, and we freeze it, we keep it stored in our cryogenic tanks. So cryogenic freezing means the cells are frozen in liquid nitrogen. Okay, liquid nitrogen does not depend on electricity, so any power disruptions will not affect the storage of the stem cells.
Okay, and then how long do you store these cells for?
Okay, so stem cells can be stored indefinitely. Okay, we can store them forever, actually. All right, but the oldest stem cells are almost 36 years old, because the first stem cell collection and transplant was done sort of between 1985 and 1988. So, and those are based in the US, and they are actually still valid and viable 36 years later. Our standard storage process or storage term is either 10 or 20 years. So you are given an option to choose 10 years or 20 years of storage. And the reason why there's an end of contract term is because by the time the stem cells are 20 years old, your child is 20 years old. And he is an adult, and he may actually take ownership of the stem cells. Okay. So that's just the one thing, is that you as a parent can say, okay guys, these are yours, now you look after them. Okay, and what happens at the end of the storage term is we contact the families and say, your contract is going to expire in the next 6 months, what do you want to do? And then we extend storage. So we extend for another 5 years or another 10 years, and how do we know that they're okay?
Yeah,
for this
that's what I was
6
wondering.
years. Okay, is we do validation testing or viability testing every 3 or 4 years, and we are fortunate to have some donated samples in our bank that families have chosen not to continue storage for whatever reason, that there's personal reasons and so on, and we use those stem cells to validate. So we take a sample that's 4 years old out of storage, count the number of stem cells, and we can compare that to all the other samples that are 4 years old. So that's how we validate storage. I think as time progresses and stem cell banking becomes of age, I think our storage terms will extend.
So I've got two questions, because now something is stuck in my mind. You've done all of the effort now. You collected the stem cells, or you handed the box to your doctor, you collected the stem cells, but it's not enough to be processed. Fine, you get the reimbursement, but do I get another opportunity to collect those stem cells?
So just to take one step back there, is that remember, if we're collecting, volume is only related to the blood. Okay, when we do a stem cell collection, we collect blood and tissue always. Okay, so if the blood is collected and it's not viable or not enough volume, we still store the tissue stem cells. Okay, so we still got stem cells stored, and as I mentioned earlier, those mesenchymal stem cells from the cord tissue are so valuable, and their potential can blow your mind. If you think about they're little cells with GPS signals in them, and when they are put into the body, they're either injected or put in through a drip. They have a little signal inside them that says, okay, go and fix the broken part. And that's how incredible the body is, and how incredible the science is, that our body is actually designed to repair itself. But these stem cells, we're just giving them new plasters.
Yeah.
Okay, if you think about it in a very simple but beautiful way, is that is how stem cells are actually working, is they're replacing what is broken. And the cord tissue stem cells also, from a matching perspective, they don't necessarily have to be an exact tissue match, which we haven't really spoken about, but when we're doing a blood transplant, a cord blood transplant, the recipient needs to be the same tissue match as the donor. Okay, so if they're my baby stem cells, the recipient and donor is the same person, so they can always use their own stem cells. But if it's a brother or a sister that may need the stem cells, there's a 25% chance that siblings will match one another. So in that circumstance, we would always just have to test the two to see if they do match. So if we aren't able to store the cord blood, not all is lost. But unfortunately, once the baby is born, that opportunity to collect the stem cells is gone.
You're actually answering a question that I've seen many times before. I changed my mind. I said no, I changed my mind. Can they still collect it? The placenta is still in the hospital, and it sounds like that is a no.
In some of the metropolitan areas, the bigger hospitals, we have got emergency kits in the labor rooms. Okay, so if you are stuck and it is like sort of 99, you think, oh sure, but I want to do that and I forgot, just find out from you can contact us at Netcells, and we'll be able to say, okay, at your hospital, yes, there is an emergency kit, or you ask the labour ward staff, because they will know.
But you don't take anything from the placenta, do you?
We don't know, because placental tissue is also mesenchymal stem cells. So when we store the cord tissue, we store it, it gets cut up into tiny little pieces and get frozen also in liquid nitrogen in 3 or 4 tiny little what we call cryovials. Now when we culture those stem cells, just a little bit, almost like the tip of a teaspoon, is taken out and cultured in a petri dish, and we can make millions of stem cells from that. So we have not moved into the space of collecting placenta tissue also, because it's almost a duplication of service.
Okay.
So we don't do that.
Can it happen that you say that you want to do the stem cell banking, but the baby is really struggling after birth, and delayed cord clamping is a bigger benefit, just like you mentioned now? While they might be resuscitating the baby, they want to do delayed cord clamping, which means you miss your chance. Who gets to make the decision in the end, if that should happen?
In my experience, the obstetrician and the pediatrician make that decision, because ultimately, at the end of the day, we will always prioritize the life of the mother and the life of the child, or the well-being of them rather. Okay, and if the stem cells, the cord blood is not collected, we know that the baby is getting the immediate benefit of those stem cells. And then just to remember that we have the cord tissue. There's always an opportunity to collect the cord tissue. And you know what, if the doctor says, oh, there's no more blood here, that's okay, we respect that decision, okay? Because we also don't want to create unrealistic expectation. To say we've collected this and we get 10 mils of blood in the little bag. We can't use that. All right, and I know it's very disappointing. I have those conversations with moms and dads sometimes when this does happen, and I know it's like your heartstrings are torn because you so wanted to do this for your little person, but you will still be the best parents for this child.